So this video is going to be talking about prostate cancer screening, which is all in the news based on the task force's recommendation. And while I do a weekly video, I'm assuming that at least some of you don't know that and don't know who I am. You're just attracted by the subject matter. So I think it's important for you to know who I am and where I'm coming from. I'm a 68-year-old medical oncologist. I treat prostate cancer patients exclusively. I have a clinic, therefore, full of men with cancer recurrent after surgery or radiation who are trying to stay alive and maintain the best quality of life possible. I'm also a prostate cancer patient. I was diagnosed in '99 with cancer that had spread to my lymph nodes. I happen to be disease-free, but my disease was diagnosed at a fairly advanced stage because I neglected to go for screening. So clearly I have a bias. I have a horse in this race. It's interesting because, of course, if people don't screen for prostate cancer, there'll be many more patients with recurrent or advanced disease. So what the task force has done is guarantee that there'll be plenty of business in my clinic. Unlike maybe perhaps some urologists, I'm not going to lose income because of these recommendations. But I'm filled with a terrible sense of foreboding about the needless suffering and deaths that the recommendations cause. So I got up on the website, I read their report, and I'm in this business. I know these studies, I've been following it. I'm a patient, so I'm passionately involved. And talk about boring, dull, dry. They clearly hadn't gotten much into their material. And it was the class reading this, you could just tell they hadn't seen the forest for the trees. They're just looking at the trees, not the forest. They don't see the big picture. So rather than delve into the details of the studies, which I'm going to do in our newsletter, I'd like to talk about the big picture. Because if you take the big picture, the craziness of this thing is just overwhelming. So every year since 1990, there have been between 20 and 35,000 deaths from prostate cancer every year. That's not a minor problem. It puts prostate cancer right up there with lung and colon cancer as the three major causes of prostate cancer, of cancer deaths in the United States. One of the top 10 causes of death among men. So this belies the implications of the task force report that this is an indolent, slow-growing disease that does no harm. So why is there this conflict between the mortality figures and the vision of the disease portrayed in the report? Well, unfortunately, prostate cancer is complex. There are two different forms of the disease. At one extreme, there's an extremely common form of prostate cancer that's very slow growing, doesn't spread. It's about as common as gray hair, part of normal male aging, never going to cause a medical problem, never going to cause a symptom, and doesn't need to be diagnosed and treated. There's a less common form of the disease, which is aggressive, relentlessly growing, and will kill you if you don't get rid of it. The best analogy I can come up with is Arnold Schwarzenegger in The Terminator. Prostate cancer in this form is the Terminator, and it will get you if you don't get it. And it's the contrast between these two. So what this task force has decided is that to focus on the benefits of the common indolent cancer and ignore the problem of the lethal and advanced disease.